Welcome to our webinar on using market research to power content marketing connections with hospitals and health systems. Today, we're talking with Trish Rivard, CEO and founder of market research partner Eliciting Insights. They're a healthcare market research and strategy consulting firm trusted by organizations like HFMA and vendors across the industry. Trish, thanks so much for coming today. But before we get into detail, tell us a little bit about what you do.
Oh, thanks, Megan. So as Megan said, my name is Trish Rivard. I'm with Eliciting Insights, and we are a market research and strategy consulting company. We work with healthcare technology companies. Really, the reason we started Eliciting Insights was we were product executives, and we needed good market data to know which products we should be launching, which products we should be adding feature functionality to. And what we found through the past 8 years is the entire growth function of a healthcare technology organization needs market data. So, anything from competitive intel to new content to brand awareness are all things that health tech organizations really need insight into. And so we originally started with product and very quickly expanded into the more broader growth function, including marketing, sales, and even client services.
Right, and that's why it's such a good fit for potentially for content marketing, because it all plays into the same end goal, right?
Absolutely.
Right. So let's move to our first question. So what does your panel of hospital and health systems executive look like? So like whose experience could a vendor be tapping into if they invest in market research for their content planning?
Yeah, so our panel right now, so we have over 3,000 healthcare executives, primarily hospital executives. We do have some physician executives, and we have a strong focus on the CFO as a buyer. We do have some representation in the more clinical buyers like CNOs and CMOs. And we have a lot within finance and revenue cycle executives. That's an area we've done a lot of focus. We're also comfortable with many other areas within health systems or provider.
So how does a survey work? How many responses do we need to get an accurate picture? What does the process look like going forward?
Yeah, great question. So we built a panel because when you do cold outreach to provider executives, you really get a low response rate. And, at Eliciting Insights, what we've done is over the past 8 years, we've developed relationships with these executives as that middleman, that third party that they can provide unbiased feedback to. And then we essentially blind the data, we aggregate it and provide it back to the health tech companies with the, really the scale of information. So enough respondents that they could make good decisions, and also, at an aggregate level so that they can make the decisions they're looking to make while protecting the confidential information of the respondents. From a survey perspective, so typically a survey, really once you get beyond about 60 responses, the numbers don't vary very much. So depending on the level of precision, 60, 80, 100, and then if you're looking for, really tight precision, then we'd suggest going over 100, or some of our clients, depending if they're looking to create some market, trying to create some white papers and looking for statistical significance, then we'll go to 260 respondents or higher. But really, if it's really just from a market poll standpoint, 60 to 80 will give you directionally the data that you need.
That's really good to know. So I know we've got like a ton of options in using research to create better informed and more effective content. So what are some of the kind of questions or topics or actually use cases? How can vendors use your research to create better content?
Great question. So we see a lot of requests for brand awareness. So does the market know our brand, or if we've had clients that have rebranded, that's a popular one. Also, how does our brand compare to our competitors? Do our competitors have higher brand awareness than us or not? We also get a lot of requests for, really need to understand a little bit more about who's the buyer, who's the influencer in these decisions. Who should we be talking to? So that's another area of focus. Also, we have clients that need unique content. So they're looking to put together a white paper, really get some some quotable stats, and those are really fun too, where we can go out and ask the market, about some topics that we just haven't seen a lot of coverage on, and be able to create new and fresh content for our clients.
Awesome. Now, you also offer individual interviews with individual hospital and health system and healthcare leaders. How do those work, and how have your clients used them in the past?
Yeah, so interviews are a great tool. Interviews are qualitative research where surveys would be quantitative. Generally, if we're doing a big market study, we like to start with interviews. So we'd like to get some qualitative insight before we even go to survey. It gives us good information on what answer choices we should be offering or how to frame the questions before we create a survey. Individual interviews are extremely powerful, and they help us understand what questions we should be asking that we haven't thought to ask ourselves. So individual interviews are very powerful. I think some of the best use cases for individual interviews are if you're trying to understand your buyer persona. So how does that title really think about the challenges that your product solves for, and how much real estate is it for them? Is it top of mind? Is it one of their top 5 pain points? Or is it something that is on their radar, but not something they think about every day? I think personas and persona interviews can be very powerful in helping a vendor understand where they fit in their buyer's priorities.
Staying on that topic, what are some other ways the results can be used? So like maybe entering the healthcare market. I know you discussed product already. So what are some other options?
Yeah, no, absolutely. For vendors looking to enter the U.S. healthcare market, absolutely interviews and surveys can be very powerful. Sometimes if you have a product that you want to enter U.S. healthcare, making sure you're focusing on the right market pain points, having that right value prop, or, is there missing feature functionality that you need to focus on? So absolutely entering the U.S. healthcare market is a great recommendation, or, product market research is great for entering the healthcare market. A lot of our clients are looking for insight into how their buyers think about the world and how they make selection decisions so that they can create better content, more targeted content. We also see a lot of requests for market research around a new product. So of the 3 products I can build in 2024, which product should I be focusing on? And for my current product, am I missing any feature functionality? Is there anything that the market needs for me to have within this product that I'm not thinking about? I know from my experience in product, sometimes product organizations can be very focused on what competitors have and where they have feature functionality gaps. But it's really important to go back to the market, because sometimes your competitors are building things that the market doesn't necessarily appreciate. And there's no point in you building that when you can actually find some other feature functionality that really resonates with the market.
So true. And how long does a survey typically take?
I would say, depending on the complexity of the survey, typically it's 3 to 4 weeks. If client has a specific business deliverable and it's a more limited survey, what we call like a market pulse, that could be done in 2 to 2.5 weeks. Generally, I like to say 3 weeks. We spend the first week really working with the client, understanding what they're trying to achieve, creating the survey, testing the survey. We go through an extensive testing process where we have some health system executives take the survey and give us feedback on the questions, just to make sure that they're written in a clear way that they can answer in the right language that makes sense with the market. And we've all taken surveys where we've seen where you think, geez, I'm not really sure. Are they asking this or are they asking that? Well, as a market research firm, that's a problem with the survey. That's a fundamental problem with the survey, because if there's any ambiguity at all, you're going to have to throw the question out. You're just going to have to throw the data away, because people are responding to it in different ways. So we go through an extensive testing process, and then usually what we do is we do a soft launch. We look at the data, just make sure that the answers we're getting to the questions make sense with what we've expected. And if not, is it because we're missing some answer choices, or do we have some duplicative answer choices? And really we do that soft launch, and then that gives us a chance to just revise on the fly, and then we do a full launch. Getting to the live surveys takes us about a week, and then a week for the survey to be live to gather the data, and then about a week for us to do the analysis after the fact.
It's really useful. Like the great thing about this kind of research is that it can open the door to so many other options and leveraging really deep insights into your marketing and strategy. What other kinds of market research could this springboard into?
Yeah, we do a lot of product work, product roadmap planning, and we also do a lot to support the sales team. So over the past, I'd say 2 to 3 years, win-loss analysis has been really, a hot area for sales teams. Just being able to understand, why they were selected or why they weren't selected, who else was considered. And also just getting some competitive intel throughout the process. And then from like a product roadmap standpoint, why spend $5 million building a product if you don't know if the market's actually going to buy it? So spend a little bit of money up front, understand, what things the market really cares about from a product, so the what, and then if you build that product, what are those key feature functionality that you need in that minimally viable product? I can't tell you how many times our clients or even, throughout my product career, you've run out of development capacity. And so you heave the reports. Well, the reports are what the client needs to be able to show the value of the product. And you cut out the reports, and then you have a product that gets them halfway to where they need to be, without really solving the pain point that you were looking to solve. So, the market research can be very powerful for helping an organization stay laser focused on what it is to build.
And that's so important in healthcare today. This has been super informative. Thanks so much, Trish, for talking with us today.
Yeah, thanks, Megan. Great to be part of your webinar.